Officially leading the Department of Health and Human Services, RFK Jr. says nothing is off limits and plans to order HHS to investigate antidepressant medication, ultra-processed foods, artificial additives, and even childhood vaccine schedules. Well, joining us now to discuss what we can expect is Dr. Joseph Varon, Chief Medical Officer and President of the Independent Medical Alliance. Good morning to you, sir. Good to see you.
Good morning.
What immediate actions can Americans expect from RFK Jr. To take when it comes to health care reform?
I mean, clearly he has a lot on his plate, and he has to look at a lot of things. But probably the one that we're going to see the first is going to be his work on trying to get pharmaceutical companies to be transparent. He's going to go after companies that make vaccines. He's going to go, like you mentioned earlier, against ultra processing of foods and things like that. But more importantly, I think he's going to go into trying to truly make Americans healthy again. And he's going to try to focus on prevention, which is one of the things that we have not looked upon.
How will he challenge Big Pharma's influence on medical policy, do you think?
Transparency. That's the most important thing. We need to be able to have all these pharmaceutical companies be transparent. Show us the data. You cannot have a vaccine manufacturer says, I'm not going to show you my data for 75 years. They have to show us the data so we can assess, is this something that we can use and should use?
What steps have to be taken to rebuild trust right now in medical institutions, doctor?
Well, you know, for the last 5 years, we have lost trust. I mean, the American public does not trust the healthcare institutions, does not trust the doctors because there has been so much miscommunication. The first thing is to unify communication. So everybody needs to sit down, talk together, and come up with a unified voice, and that's what needs to be done.
In the meantime, your organization, the Independent Medical Alliance, is leading the charge for health care reform. So what kind of role will your organization play in shaping national policy under RFK's leadership?
Well, you know, our organization has an arm that looks into science and another arm that looks into advocacy. We have a 501c3 and we have a 501c4 corporation. And what we try to do is to orient, if you want, the administration, provide the administration with information of what we think may help us develop a much better healthcare system.
And I understand you're going to be launching this new medical journal. How is this going to lead the conversation in honest science and be different from mainstream medical publications?
Well, that's a great question. You know, we launched the Journal of Independent Medicine 2 days ago. And what happens is that most of the journals, I don't know if you've seen, I mean, they're literally kept hostage by Big Pharma because they are the ones that are funding them. So our journal is completely bias-free. It's a journal that is not sponsored by the pharmaceutical industry. It's a journal that is transparent, that has peer review. And what we're hoping to do is to be able to bring that trust back to people and say, hey, science can be done. You can publish good, strong science without the influence of Big Pharma.
For more information, you can go to imahealth.org. Dr. Joseph Varon, great to see you, sir. Thanks for joining us this morning. We appreciate it.
Thank you for the invite.